Thank you, the Hindi team, and good evening, good afternoon, and good morning. This is the 2120th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SADATH SAIT. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money, and you can share it with anyone who loves homeopathy. And let me come to today's guest. As you all know, today our guest is Dr. SADATH SAIT from Kerala, and Doctor is the chief physician of Dr. SAIT Homeopathy Cochin and Alva, and he is a leader of various organizations, and he is the official at CUFA, that is Qualified Homeopathic Private Practitioners Association, and he has taken a lot of sessions in our webinars, and he has more than 27 years of clinical experience, as well as he is one of the most wanted faculty in our Kerala. And today, Doctor is sharing some of his clinical experience. So we hope all of you will enjoy the beauty of homeopathy from Dr. SADATH SAIT. So I am making Dr. SADATH SAIT the host, and we are sorry for the inconvenience caused due to some technical failure from our part. So we welcome Doctor.
Okay, thank you, Dr. Dhanesh. I was just wondering what is happening. Always my laptop used to hang.
No, so it was
I was just wondering what is happening.
unknowingly the person
Okay, don't
closed the
worry. It all happens. Don't worry. That is the fun of it. So thank you. 2,120 classes without break. It's something amazing. And all congratulations to the team IFPH. Thank you. Today, let's start with my few experiences in the clinic and why that prescriptions, how things taken up. Today, we start with the Kerala monsoons. Okay, let's start with the Kerala monsoons. What is happening? Most of the cases nowadays we are getting Shigella as well as dengue. Viral fever, though common. Viral fever is so common that dengue and Shigella is coming into the more frequent. Uh, The dengue medicines, as everyone knows, my favorites are X-ray 30, phosphorus, epitorium instead of restox. If you get tongue coated white and the tip is red, you can give the restox instead of epitorium body pains. So the starting is if its platelet is less and below even 15,000, not 50,000, below even 15,000. Okay, we can think about giving X-ray. Phosphorus, these two medicines you have to be always with you. Plus, you can give Vitorium perfoliate. Plus, if there is a clear-cut indications of any other complaints, any other symptoms or PQRS, you can prescribe that. But usually, 90% of the cases you can blindly close your eyes and give it as X-ray 30, phosphorus, and Epitorium. And most of the cases they give it a carica papaya also, but carica papaya, in my experience, it has not given me uh, that results. Okay. Restox are there, gelsemiums are there. Gelsemium is also another one medicine we can think about. But X-ray, radium bromide, epitorium, these 3-4 medicines can bring back any kind of platelets to the normal. Phosphorus even prevents the bleeding. X-ray, it brings out the platelets to the 1.5 in 1 or 2 days. Maximum is 2 days. 1 point X-ray brings it up to from 15,000 even to I can give you the details about it. My experience of even treating almost many dengue cases. My prescription is either Restox or Restox or Epitorium. These three, four medicines, I keep repeating it either alone or at times if the patient is away or far, then we'll have to take this big risk of prescribing everything together. We cannot keep playing with the patient. So, and this will affect or that will affect, I don't know. But we have to be more stronger and we have to give the medicines and get the results. Okay. And now the new cases are Shigella. Shigella is with uh, today also I had a case of dengue positive. Same thing is repeated. In 2 days, the patient will be all right. Shigella, we have got medicines called Merxol, Arsenicol, and camphor. Camphor. Mercor, more the blood, more the soul indicated. So the Merxol, if there is a tenuousness after stool or anything of the diarrhea, Mercor is also indicated. Phosphoric acid is another one medicine. Diarrhea will be there, but the patient is will be little weak. Arsenic alba is one of the best medicines for us. Okay, and Ruta even covers the rotavirus infections also. Okay, we can even give the influenza, one dose or start the medicines with influenza. So these are the practical experiences we are talking about. Theoretically, we can give the no. Whatever I'm telling you is, it is all from my experience of treating thousands of cases of dengue. Dengue, I have even a lot of cases to be treated, uh, and it gives a lot of results. So these two things, these two start. Kerala is facing these two the epidemics, most of the cases, and 100% surety we can treat the any cases. Okay. Now let me go to the proper screen sharing with uh, share with my people. This one. So I just wanted to tell you this. Any cases of 90% of the cases of dengue, we have the medicine. These 4 or 5 medicines, we have it. That's more than enough to treat any case of dengue. Okay. Let's get into the throat complaints directly. Because nowadays a lot of throat complaints along with the viral fever is coming. Otherwise also there is a problem in the throat complaints. What we do is in the clinic is we just examine the patient properly and accordingly we will have to think about it. Every time we will not get a constitution, we will not get specific medicine, specific symptoms. We must be getting 1 or 2 symptoms. That's it. At time, how much ever we get, parents don't know. Either parents are not aware of it, or parents we don't get the symptoms at all. In those cases, you can just blindly give these medicines. Otherwise, you can give single medicines and wait and do that things. That is taking the cases in a proper way. Most of the time, I don't get the cases of this in acute cases. You get 1 or 2 or 3 symptoms or one PQRS symptoms. We'll have to go and treat. Okay, we'll start with the adenoids. This is a common symptom, common complaints we see it in our clinic. Okay, along with Agraphis nutans, Calcaria carb, iodine, Kali, bike, everything, all the medicines, we have it with in treating the acute complaints of adenoids. But along with that, Sanguinaria nitrica is another one best medicine. You can even try it at any time. Scrofularia nodosa. Scrofularia nodosa is even better for the Hodgkin's lymphoma. This one, Phytolacca is another. Phytolacca decantra is also good one. Scrofularia nodosa. Calcaria iode. Calcaria iode lower body. Okay. Along with other all acute medicines, think about this sanguinary nitrica and scrofularian nodos. Okay. Next is esophagismus. You get a spasm where you cannot take any medicines. It could be a nervous spasms or it could be reflex spasms. Okay. Nausea is one of the best medicines if you get patient cannot eat food. Patient gets chocked. Small quantity is passing. The patient gets nervous. Naja. Naja is another snake medicine. It has the, if you go through the symptoms, Naja, lacus is all that has a sensitive throat. It feels as if someone is choking your throat, right? So Naja is another, instead of lacus is all that you can think about, but Naja has more contractions. Ignatia, if the case is this one. Esophagismus, if you can give up this one. Robinia and Robinia and Abies nigra is also another one of the best medicine. Then Raphanus. Raphanus is also another one of the best medicine to treat the acute complaints. Veratrum viride and Baptisia. Baptisia, solid cannot pass, only liquids can pass. So that one symptom you might get it. Sometimes with heartburn or without heartburn. So you get only this symptoms. One symptom or two symptoms, you have to prescribe. Okay. Dysphagia. Dysphagia, a lot of medicines are there. I'm not going into the common medicines where everyone knows, but my experience, I add these two also in most of the cases. Dysphagia. Capsicum is also one of the best medicines for dysphagia. It burns. It is like a burning sensation, just like a bell pepper or any kind of a this one. What are called uh, chili. Because the chilies are always hot. So chili is something which you cannot even think about it. The hotness. Capsicum, stramonium. You get dysphagia because of the construction, or even the strictures, even the spasmodic construction, uh, spasmodic effect also. Veratrum will same way. Uh, okay, this page is phosphorus. Phosphorus is one of the best medicines. The first thing, these three medicines counts very faster, and you get the results immediately. Okay, then if the case is chronic, you give the relief to the patient, then you go for the constitution medicine, take the case in detail and find out what is the root cause of the esophagitis or dysphagia. Sometimes the stress or death of someone or lot of stress factors can create it. So euthanasia, then natramure, all these medicines happen. Deposits in the throat. You see the tonsils. You get the whitish deposits or yellowish deposits. In that case, you can give a throat gargle with our medicines like calendula, echinacea, then baptisia, and mouthwash. Instead of that Listerine or something, we use it as a this one. You go give our medicine, belladonna, to relieve the congestions of the throat. Then give these medicines. Acetic acid is one of the best medicines. Merc cyanide. Merc cyanide. Merc cyanide is also one of the best medicine for the deposits in the throat. That deposit like white, this one just goes off with the tonsils. Okay, globus, ampragracia. Globus, you feel hysteric, as if something is lodged. Okay, this one is also there. What about? But most of the cases, ranunculus bulbosa, that is also another one medicine is there. But Emperor Gracia clears of 90% of the cases. Hawking has to clear. If there is a cough or tonsillitis or adenoids, most of the cases have got the results in Vyathia and selenium. Okay, Vyathia and selenium. So these are the acute prescriptions. Constitution medicines are there. I'm just giving you the medicines which you can give evidence based, but these are nothing to show the evidence base. This is there, that is the next time I'll keep clicking the pictures of this once you start. Pharyngitis, what to click the pictures. This is this, you give the medicine and this is the result. Glycerin, pharyngitis, we have a lot of medicines. I'm not going into the details of the medicines. We have got Hepasol 2, Bacteria 2, Arganometricum 2, anything, lot of medicines. Glycerin is one of the best medicine for that. Cough after influenza, glycerin. Cough after influenza, Riodictone is there, Natramur is there. But glycerin covers this symptom faster a bit. Riodictone. Menthol is another one medicine. Menthol just gives you a cooling effect, just like any Vicks. What is the content of the Vicks that gives you a cooling effect is a menthol. So that is a synthetic menthol. Here we get the natural menthol as of our medicines. Means synthetic only prepared into 30 to 100 to 1 So menthol is also one of the best medicines for pharyngitis. And all this is coming up in this rainy season, monsoons. Tonsillitis. With hundreds of medicine we have it, but try this, Gymnocladis. Gymnocladis is one of the best medicine which gives you much relief. I got it from one of my friends. He had sent it to me. Gymnocladis. It's one of the beautiful medicines. Blind, even you can close your eyes and give it if you don't get the other symptoms. See, once if you get the symptoms, if you get the clear PQRS, prescribe that medicine only. If you don't get the clear picture, you get 1 or 2 minutes. This one, tonsillitis is there, just tonsillitis is there, slight pain is there. Nothing you are getting it. If the other patients are, if you are not getting any other things, you can give this Gymnocladis. Okay, redness of the throat. Again, Gymnocladis. Gymnocladis, if there is a red throat, painful throat, congestive throat, with belladonna, you can think about Gymnocladis. And this again, respiratory. We'll just go into the common diseases we get it in the clinic. Then we'll go to the more complicated cases. Asthma. Asthma, sterculia is one of the best medicines. Along with Aspidosperma, Grindalia, Aurelia, lot of other cases with all the arsenic, all other medicines. Think about this also. Sterculia, I got it as an accidental one. One of the patient came, he was a gymnast. He wanted the medicine for the energy. So when I was going through, he was pestering me like anything. I said, I don't have that much of medicine or that kind of a medicine to give it too much of energy. Sterculia, spirulina. We have few medicines, but I was not sure about. He was a gymnast. He was a coach. Instead of giving dopamine or that, uh, he wanted the medicine, homeopathic medicine for his student, where he is coaching instead of that steroids. So he wanted a homeopathic medicine. Along with that, I went through that boric and I got the sterculia. Bodybuilding. Sterculia is one of the best medicine for the marathon runners. It's a bodybuilding. It helps in the energy. It helps in the bodybuilding, not the two. This one. Asthma. Adrenaline is another one of the medicine. Okay. Solanum lycopersicum. That is also gives you much better relief in asthma. That is Solanum lycopersicum is also integrated in the right deltoid pain. Okay. If any patient comes up with a deltoid pain, and you cannot lift the medicine, lift the hand, give this. Okay, we have a ledampal is there, then other medicines also, but solanum lycopersicum is one of the best medicines. Okay, asthma, aggravation, sleep apnea, Merck precipitous rubor, common medicine. Asthma, aggravation, sleep, along with Grintalia, Arsenicol, you have this sitting, you have that sitting, you have turning to the right, you have turning to the left, you are going into the open air, pulsatilla, all that is there. I'm not denying all that is there. But asthma, aggravation, sleep, if there is a associated with sleep apnea, if it's a cardiac also, Merck precipitatus rubus can give you much better result. Inability to lie down. Again, sleep apnea and cardiac asthma. What kind of a congestive cardiac diseases? Aggravation even lying down, aggravation even rest. Okay, all the medicines which we commonly use, try this also. Convaluria mejalis, heart remedy for CCF, dyspnea on waking as if heart is stopped. Convaluria mejalis. Okay, this is also one of the best medicines. Pericontritis. Pericontritis. That's I just added here. Inframammary pericontritis. Pericontritis is in between the ribs and around the ribs. Pain. Ruta, simicifuga, inframammary. If it is inframammary pain, simicifuga is one of the best medicines. Then Asclepius tuberosa. Asclepius tuberosa is another pericontritis. All the even you can think about it in the costochondral pains, costochondritis or costochondrial pains. You can think about Asclepiasis. Bryonia is also one of the best medicines for costochondrial pains. Ruta is another one of the best medicine. You can start the Ruta with the 30 or pincher or going into the 1 10 Ruta tendon has a beautiful action in any muscle pains or any body pains or any costochondritis or any costal pains, perichondritis pains. Ruta tendon is one of the best medicines you can even think about it. Repetition, I repeat frequently with the severity. I even give the Ruta even 10 minutes. I even give the Ruta in 15 minutes. I even give them the Ruta in half an hour, 1 hour. So this is plain my experience. And you get a result of the pain reducing it within even 1 hour or so. 1 hour, 2 hours, you are getting the relief of the pain. Once the patient is relieved, then you can give any medicines or constitution or that or this. You give any medicines. That is not the concern. Simicifuga, any joint pains, same. Pericontritis, joint pains, muscle pains, even the ribs, costochondritis. Simicifuga is another one of medicine. And if it is inframammary, okay. Inframammary is something which specifically it is simicifuga. Okay, Asclepius tuberosa. This is also one of the beautiful medicine for this kind of a pain. Cough, cough. Along with the common medicines, you can think about Lactuca virosa. And Lactuca virosa is one of my favorite medicines. It's a common medicine I use even for the breast, that milk increase. Lactuca virosa is to increase the breast milk. To increase the breast milk, Lactuca virosa is one of the best medicine along with other medicines are there with us. But Lactuca has given me much results. Maybe around 30, 40 or 50 cases I have seen after pregnancy. Lactuca virosa has given me at least 70% of the cases. If Lactuca virosa doesn't work, then I think about other medicines. Okay. Lactuca virosa, cough at night, cough, uh, severe cough, where we can think about Drosera. Okay. Senega, you can't, I cannot forget this medicine, Senega. It has saved me in COVID. COVID Senega has helped me in 99 cases of COVID CT. The only symptom we get it in the COVID is you get it as that glass. When the glass is accidentally fractures, the glass fracture. What to call pathologically, Seneca is more indicated in that kind of a this one, almost fibrosis with what to call the clear symptom is uh, just like any modern cars glass gets damaged, it doesn't fall, it just gives a crack. So that kind of a symptom you get in any CT if you go in for Seneca. If you get that, there's nothing like it. Seneca can be given in COPD. Seneca can be given in bronchiectasis. Seneca can be given in old age. Okay. So Seneca is so important medicines for me. It has saved hundreds. Maybe I cannot even say hundreds. It's more than thousands in COVID. Okay, that was the fun of it. Santonium, Santin. It's not Santin, it's Santonium. That is also one other medicine. Osmium. Osmium also one of the best medicine for cough. It is a continuous cough, dry cough. Okay. Oleum jack. Oleum jack can be given thought about it in any cough. Oleum centale, if it is the case is night cough. Zingiber, Oleum centale. Viburnum prunifolium. Night cough. Oleum centale, Viburnum prunifolium, Oleum jack. Osmium is one of the best medicine even for eye complaints. Osmium is a glaucoma conditions. Almost you can keep it in glaucoma conditions. It will help you. Okay. So think about all this. This one, Materia Medica is something which is very vast. You keep reading it. One day you get another day you get another versions of it. So critically analyze Materia Medica. Symptom wise, they will give you something else. But once we correlate with the disease, okay, what Boric has given is glass crack kind of a symptom. Where you get glass kind of crack kind of a symptoms in respiratory. We saw it in COVID, bronchiectasis, COVID. COVID pathology was the same. It gives you a lacunae, and from there it is like a crack, fully cracked. Wherever you go, it is a 1 point and crack, 1 point and crack. Whole lens was that. So when a car glass breaks, it breaks in 1 point, then spreads. Same thing you get it in Seneca. Cough during talking. Either you can give hypotency or mother tincture. Cough during talking. I know cough during talking, you have to go in for the diagnosis if it is a CCF or any other complaints. You rule out that there is no CCF or any congestions. Bronchitis, nothing. Drosera is something I've been hearing it from the first day of medicine. My passing out in '94. Drosera, before you give Drosera, you have to be double, triple, four careful. But I would say my experiences, Drosera can be given in any potency, any time, any frequency, any repetitions. Okay, people challenges, all that is there, but this is what I give it. This is what I know. I have experienced it. I have experimented it. So Drosera, don't get scared in prescribing Drosera. Okay. I have clearly written high potency and mother tincture. So there's nothing other thing than that. 1M, 2 or 10M, 30. 30 is very less in cough and aggravation and throating. You can go for directly to mother tincture or either higher potency, lower potency, thinking about the severity. Okay. Laryngitis. Again, laryngitis, we never think about Seneca. Seneca is another one of the best medicine for laryngitis. Pharyngitis, laryngitis. Okay. Mencanum aceticum. Mencanum aceticum. Again, selenium. Another one medicine is kaolin. Kaolin. Read that. Cox lymph. Tuberculinum and cox lymph is different. So here we have to give laryngitis. Cox lymph is one of the best medicine indicated. Kaolin again, it gives you redness. It gives you more congestion. It gives you hoarseness even. Okay. All medicines are available in your books. Nothing has come from my whims and fancies. Cough aggravation at night. Prunus virgininus. Codinium. Codinium. Codinium is an alkaloid of opium. So opium is also good medicine, but codinium is more specific. It is taken from the alkaloid of opium. So that gives relief to the cough at night. I'm not saying that all that gingiber is there, Prunus virgininus and Viburnum prunifolium, Prunus virgininus. This is one of the best medicine for aggravation. Oleum centrale is there, Oleum jack. I've given you all that. Dry cough, again, formalin, Trifolium potens. Formalin, what formalin does? What is the doctrine of signature of formalin? Formalin is a gas, right? Formalin is a gas. It just gives like a hot fuming irritation. It irritates the throat. So once that is irritating, it becomes a dryness also. So dryness can bring dry cough. The dryness of the esophagus, the dryness of the bronchial tubes, not esophagus, bronchial tubes can lead to dry cough. Formalin is also one of the best medicine. Trifolium proteins. Go to the boric, read. It's one of the beautiful medicine used for like Drosera. Pertussin, another one of the best medicine. Pertussin. Pertussin is like sure shot. Okay. You don't get any medicine in your clinic, keep Pertussin for the dry cough. Drosera, 3 paroxysms, think about only Cupramet. If the dry cough comes in 3 paroxysms, you finish 3 paroxysms, then give a break, then start this one. Close your eyes. Cupramet is another one medicine. Cupramet can be given the even in the muscle cramps, cold climate, old age. If the patient has a diabetes, muscle cramps, it gives you much better results. Okay, I'm not denying the other medicines, but this is also one of the best medicines possible. Cough in old people, hypoxianum. Hypoxianum is one of the best medicine. Creosote, we don't even think about creosote in cough in old people. Senega, Hyoscyamus, we give it for the night cough, uvula elongated, right? Even the cough in old people, okay? So geriatric cases, we have a lot of medicine even for the respiratory, COPD, bronchitis, hypoxianum, creosote, Senega. See, whatever I'm saying is, you just give it in your clinic, you give it to the patient. When another patient comes, try this medicine and please let me know your experience. We have Dr. Jayaram. He used to tell all this medicine, that medicine, this medicine, but he calls us. He calls me up and asks, what happened after you giving the medicine? What is the result? So that is a learning for us also. So it's a give and take. Okay. It's not a monologue, it's a give and take. Intercostal pains, ranunculus bulbus, this one, Asclepius. Okay. Intercostal pain, I gave you simicifuga. Same, ranunculus bulbosus, one of the best medicine for even the herpes. Ranunculus bulbosus, intercostal pains, neuralgic pains, muscle pains, anything. Think about ranunculus bulbosus and Asclepia. Okay. Cough evening and night. Prunus virginiana, especially in elderly people. Prunus virginiana. Okay. Evening and night. These are all common symptoms we get in the clinic. Right. But along with that, we try all the medicines, but try this also. Reading, laughing, talking, Droser and ambrosia. You get cough when reading. You get a cough laughing, talking, Droser and ambrosia. If the expectoration is salty, we have to be very, 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 very careful. We have to rule out the diagnosis of Sister's cavernosus. Okay, that diagnosis we have to think about it. But just think about it. I got only 1 or 2 cases with salty expectoration, but luckily there was no complaint. But this patient was better with kali iodide and lycopodium. Okay, lycopodium, even if in the constitution, if you think about it, you take the case, if the respiratory complaint, if the constitution has lycopodium, check out if the patient has a salty expectoration. Even 90% he will tell you, whenever he coughs, he gets salty expectoration. Okay, but once you have a salty expectoration, rule out any cuts in the throat. Okay, that also has to be ruled out. We have time, sir? Okay.
Yes.
Okay, we have another 10,
15 minutes more.
15 minutes more. Voice with a deep bass. When the patient gets some throat complaints, it goes into the very deep. Verbascum. Verbascum is the medicine if the voice is deep bass. If the cough is deep bass, another one. If the voice becomes very hoarse and deep, a beautiful female comes into a clinic and talks like a male and deep voices. Not every time when there is a complaint, or even if it's every time also, you can correct it. Alumina. Alumina is also one of the best medicines. Okay, for this. Hoarseness, aphonia. All with all this, phosphorus will be my favorite. But along with the phosphorus, selenium, verbascum, and manganum aceticum. Manganum aceticum has a beautiful results with the aphonias. Hoarseness, aphonias, manganum aceticum is because of the weakness of the pharynx or larynx. Okay. Selenium, again, weakness, nerve weakness. Selenium weakness goes everywhere, even in the sexual sphere. Erectile dysfunction because of the nervous weakness. Same way here. Overuse of voice, coca, argentum metallicum, again selenium. Give it to the teachers, give it to the orators, give it to the Modi, give it to anyone they have a problem. Kejriwal. Okay, when you wanted to learn this, think about this. People. Modi is one of the best orator in long time. Kejriwal always had. Now the Kejriwal muffler is not there. Okay, I don't know what he did, but this is another thing we can even correlate. We can relate easy and faster. Overuse of voice, coca, argentum metallicum, and selenium. Lot of other medicines are there, but my experience has given me results with this more. So that becomes a faster. Hemoptysis, Hydra muriaticum, ledum with cough. Okay, arnica is there, kali bike is there, even phosphorus is there. But hydra muriaticum, ledum. These are the two medicines you can even think about. You give this medicine within 10-15 minutes, that vomiting stops. Fibrosis of the lungs, COVID, Senega and Bryonia. Okay. And another one, lateroductus mectens. Don't think that these medicines are not available. All the medicines are available. Okay, you will have to little work out from where you have to get it. Even the sleep apnea, I have told you that. Sleep apnea, lateroductus mectens. One of the best medicine. Even you will not get even more than 1 or 2 lines in this one. Even in boric, it gives in the relationships. But don't ignore this. One medicine in repertory, one medicine rubric. Don't ever ignore. That is the medicine. Even if it is not in 5 mark italics or 3 mark italics or 1 mark italics, must be just casually mentioned. One remedy rubric. It's one of the best medicines. Or that is the specific medicine for that condition or that time. Dyspnea, ascending stairs, not chairs, ascending stairs. Lobelia. Lobelia and even loro, lorocirrhosis. Lobelia and lorocirrhosis. I could even save a patient of mitral regurgitation with COVID, admitted for the valve replacement, and went for the valve replacement. That patient got COVID, so they couldn't do the surgery, and they were discharged. They said nothing is going to happen. Give it to the God. You go home. There's nothing I can. The hospital can do. They tried it. Luckily, this patient was my family friend's mother. So he had sent to me when the patient they were in the hospital for at least 1 month because they couldn't do the surgery. Luckily, when the CT was taken, this glass broken. This one was there. I just got it one line prescribed Senega and lorocirrhosis because of the lung weakness. Okay, it was affecting even the cardiac cases because of mitral regurgitation is the lorocirrhosis and lobelia. That patient is still alive. COVID is almost mitral regurgitation and mitral that valve has not been replaced. It is still the same. Patient is healthy. Patient is running around. Patient calls me almost once in a month or 15 days because that is almost 100 kilometers or 150 kilometers from here. Pathanamthitta district. Yeah, I think so. 150 kilometers. 100 kilometers, 150 kilometers. So she calls me. She is a massive ambassador for me in cases of alcoholism. She asked me medicine for 3-4 patients for 1 month, and she distributes it. She distributes it to the patient there, and the credit goes to the this patient. But they know that medicine comes from me. Dyspnea, something comes near the mouth or nose. Lachesis, okay. It feels that there is something is in the throat, and it is causing dyspnea. Lachesis is one of the best medicines. Sensitive to touch. You cannot even, the cloth is very sensitive, the hand is sensitive, patient is very sensitive. Think about dyspnea. Something comes near the mouth or the nose blockage, and the patient can't breathe. When this dyspnea, when stretching arms, don't think that this is as what I call rare case. No, patient, that shows that patient is how to interpret dyspnea even from stretching arms this way. Movement aggravation of the movement can cause dyspnea. Okay, COPD and congestive cardiac failure. Think about soranum as well as bryonia. Okay, stretching of arms apart causes this one is soranum. Dyspnea better by open air, sulfur, racked philosopher, pulsatilla is always there. But another medicine you can think about is amelioration by dyspnea amelioration open air, sulfur. Okay, we'll go to another one is stomach. Okay, appetite lost. Common symptoms, appetite lost. So patient might come, the baby will come, they will tell the all 90% of the mother's complaint. Loss of appetite. Lecithin, anemia, for one of the best medicine for anemia, lecithin. Okay, to increase breast milk, that is also another indication, causes immediate decrease in phosphate secretion. Where? Urine. Okay, lecithin, nothing like it. So anemia, you can give your 5-4s, all that, whatever we give it, that is also there. Ferromet 3x, anemia, one another best medicine, Ferromet 3x. Okay, to increase breast milk. And Natramur 3x, you can even increase the sodium. Natramur 3x, 1x, 2x, 3x, if you get it, give it. Biochemic, give that. You will get the results, immediate results. Okay, if the disorientation patient come and the sodium is less, give Natramur 3x. Don't hesitate. Lecithin, anemia to increase breast milk causes immediate decrease in phosphate secretion. Strychnine phosphatase. Okay, strychnine nitricum, craving for alcohol. Strychnine arsenicum. That's one of the best medicine even for diabetes. Strychnine can cause the muscles and nervous damages and problems. So that can be given in the case of diabetes. Strychnine arsenicum. Okay, craving for alcohol along with all the medicines for cravings for alcohol, this one, acid sulf, and all the medicines with the alcohol treatment. Strychnine phosphoricum. In the case of appetite loss. Okay, strychnine nitricum is a craving for alcohol. Appetite perverted cravings. Macabre, which condition we saw? COVID. Everything is written in the book. What I was thinking this, where is the craving of appetite perverted? Before craving, we hardly, a patient comes and tells us perverted, patient parents come, he eats that, and we said, okay, forget it. We don't give more importance to that. That was my experience after COVID. Macabre is one of the best medicine. Acid force, another one. A craving perverted. Acid and pickle, acid force. Even the macabre even had nothing specific cravings. But the result was this. Okay, you can even give medicine only on the basis of this. What I call Calcutta. Calcutta, very famous doctor is there. He used to prescribe only on this, only on the dreams. Okay, Rajan Shankaran main focus is on the sensations and sensations. This doctor used to Calcutta used to prescribe only on the this one's dreams. So listening to him, I knew that okay, dreams can be thought about it. Then we started converting it. The clinically conversion made it. Dreams are one of the best focus to prescribe, even in the constitution. You, you take the constitution, if there is a comparison comes up, and if this symptom is there in one medicine, give medicine, that medicine only. So this can be used as a PQRS symptom. This can be used as a selective symptom to prescribe medicines. Okay, repertories, you get this. Hematemesis, again, cocaine, cactus, even cocaine cases vomits. Right, if the addict to the cocaine, so we have the cocaine medicine, cactus. Why cactus? Cactus is one of the best medicine for cardiac, but cactus as this one, what I call doctrine of signature. Cactus is how it is. It is with thorns. Every cactus has thorns. Some has a lot of them that can prick and give blood, and the blood can come out. Same thing. Cactus, if you give it, use that learn knowledge to this prescription. Cactus is one of the best medicine even for hematemesis. Hiccup, gas, Kajaputtam. Kajaputtam is one of the best medicine for any GERD cases. GERD cases, heartburns, one of the beautiful medicines. Specific medicine. You can even blindly give it. I'm not, see, this medicine, when I give it, I'm not at all telling that other medicines are not good as this. No, they are as good as that. But at times, what happens is that we don't get too much of symptoms. The patient will come and tell that, okay, I have a heart burning with a gas formation. That's all. Iris 10x, if you get it from the throat to down, iris. So if you get that kind of a differentiation, you can think about different medicines. But here, nothing will be there. Patient has lot of acidity. Give Kachaputam is one of the best medicine. Hiccups, morphinum, Zingam valerianum, hiccups. Last week I had a case of hiccup. One whole day the patient had a hiccup. They kept it, and they finally one of the relative was my patient. He saw that, he said immediately call up Dr. Sadath, and they called up, and I gave morphine and Zingam valeria together because it's been one day. So carbon monoxide, anything can happen. So give this two medicines, one after the other. Okay, hyperacidity, orexinium tenacum, orexinium tenacum. Give these medicines. Our Mathematica has 4,000 medicines. We don't use more than 10 or 12 or 15 or 30. Nothing more than that. Give this. Okay, give this as specific as hyperacidity. And you try, give it, and let me know the result. Please share your results. Please share your results. Okay, that will help us grow. If you are going to treat indigestion, go for the cause of it. What caused it? Symptoms, yes, but I give more important to the causation of it. Okay, sleepiness. If it is very sleepy but can't sleep. Okay, natramure, nex moscata, feltori,
Yes.
feltor.
Yes, doctor. Just 3 minutes remaining. We can close.
Okay. Then we will
Can
go
have
for
it.
this next time.
Yes. Yes. It was really an excellent session, even though there was a little bit of problem in the beginning. And we were really lucky to have you in this session because you have made wonderful descriptions of each and every medicine for a particular problem. This is all from your experience, not from textbook side. Of course, the experience from a doctor is more important than what is written is in a particular textbook. But the experience comes from a different textbook and from the knowledge shared by the seniors. And so we are lucky to have a beautiful session in this evening. I'm inviting Dr. Ramprases to say a few words.
Thank you, Dr. Dhaneji. Congratulations, Dr. SADATH SAIT, sir. Very nice. On experience, selection remedy, important remedy, according to symptom, according to therapeutic. Very nice, excellent session. Thank you, sir.
Thank you, sir, for your lovely words.
Is there anyone want to speak to Dr. So that's it. I'm inviting Dr. Bob to say a few words, and you can say the word of thanks to the session also. Dr. Bob. Anyway, thank you all for joining this today's session, and we are lucky to have some good session from Dr. SADATH SAIT for some of the best presentations also from SADATH SAIT in this evening, and we are looking forward for some more case presentation in the coming editions of our webinars, and with that, I'm thanking you, Dr. SADATH SAIT, and those who attend the session in this evening. And tomorrow we will have a session from Jayant Rikwani, and doctor will be talking about peripheral peripheral vascular ischemia series 2. Some case presentation also is expected from Dr. Jain Rigwani. Thank you, doctors. And thank you all for joining this wonderful evening. And particularly on the yoga day here. So over to Dr. Manoj.